my view, it's a top-down reorganisation written on the back of an envelope with no small print whatsoever for two services that are already massively in crisis, that doesn't change any of the reasons why they're in crisis. It seems to make sense to people that if you've got a health service and you've got social services, they should be working together, and integrated services will surely make it better. But this isn't about integrating the services, it's about integrating the commissioning. So what you do is you merge people who will then buy and sell your health and your social care. So they will, you know, buy and sell like they do, and if you have to go to a panel for contracts, do you need somebody to come round for your 15-minute visit? Do you need somebody to provide you nursing care? Do you need somebody to do this? Do you need a hospital service here? Does it need to be in the health service? Can it be by a private company? You're not merging the services, you're merging the buying and selling. And as long as you've got a market that does that, you will not solve the problems of the health or social services. Just that process is taking up bigger and bigger amounts of health service and social services money. They reckon, Alison Pollock did a piece of research that said that 20% of the NHS budget is now spent on administering the internal market of commissioning and contracting and buying. We have thousands of managers and checkers and clinicians, people like me, I'm a nurse, who spend ages filling out the bits of paper and ticking the boxes on the computer so that we can be checked that we're billed for the right thing that we do, that we only see the people that we're contracted to, that we see them for the right amount out of time, that we get them better in the way that they want with the right numbers. It takes a huge amount of money that should be spent on healthcare rather than on administration. And the other problem is that both services have got huge cuts. Manchester Mental Health has been jointly commissioned for the last 10, 15 years. Has that solved the problems of Manchester Mental Health? No. Manchester Mental Health has been in crisis ever since it built the PFI hospital in Wythenshawe, where the beds cost 4 times as much as they did in the old Withington hospital. So they closed 30 of them when they built it, and we've been in crisis ever since. And because we're in crisis and there aren't any beds in Manchester, day after day after day, we have 30, 40 people tonight in private hospital beds paid for by the NHS on individual contracts in a jointly integrated service. It's not a solution to do it. Somebody used the analogy, in fact it's sort of Claire was at the back of the room, who said if you merge 2 leaking buckets, what you get is one big leaking bucket. It's not an answer, and that's what we're producing. But it will be a massive disruption to people who've got better things to do, trying to hold together that crisis-ridden service. And I think unless you get rid of the market and you put the money in, Devo Manc, devolution is not going to solve the problems for anybody.
Fine. Thank you for that, Karen.